Hi, this video is the demonstration of the FUE donor scar. FUE means Follicular Unit Extraction, where we shave the hair in the back and we randomly pluck one root at a time. So it leaves you thousands of dotted scar, circular dotted scars scattered throughout the back like a mosaic pattern, and allow you to shave your head really shorter. The FUE scar is less visible when you wear your hair short. There's always pro and con for both FUE and FUT. On the other hand, the FUT or the strip harvesting hair transplant or FUSS, they're all the same. That means cut out the whole strip of skin out, then we close you down, we stitch it you up, you have a tiny line of scar. The FUT scar is visible when you cut your hair really short, where the FUE scar is less visible. So there's always pro and con for both. So the pro FUE is we're not cutting your scalp open, so that means less invasive, less painful, less chance of infection, and faster healing. But there's always pro and con. And the downside of the FUE, number one, is cost. It's a lot more expensive. Number two, the number of grafts we can do is less with the FUE versus the FUT. The FUE, we range from 2,000 to 3,000 a day with the FUE, so that's why more for mild to moderate hair loss clients opt for the FUE. On the other hand, the advanced hair loss, like 5, 6, or 7, they need 6, 7, 8,000 grafts. So the strip is more appealing. Why? The strip can harvest 3,500 to 6,000 grafts per day. The other downside of the FUE, not just the cost and the density and the overall number of grafts we can harvest less, but the overall density is less. So the FUE will reduce your overall density more, so you have less hair for the future. And because throughout we randomly scatter, so then the overall density is less. As compared to the strip method, the strip, we take out the hair, but line a scar, but the hair above and below the scar the density is still intact because it's not been touched. Where the FUE, this randomly plugs, so then the overall density decrease. And because the FUE is less efficient and more scarring underneath, that means there's less amount of graft available for the future with the FUE versus the FUT. That's why the FUT is more preferred by the client with advanced hair loss, where the FUE is more preferred by a client with minimal hair loss or mild hair loss. So besides cost a lot more, that's the downside of the FUE. The number of grafts we can do is less, 2 to 3,000. The overall density is decreased more, but the overall amount of graft total harvest by the FUE will be less than the FUT. That's the other part. And then the growth rate. Now you can have excellent density with my result, whether you do FUE or FUT, but the FUE will have 10% less. My FUE will have 10% less density than my FUT in terms of the overall result. However, my FUE still look fantastic and excellent density and better than a lot of clinics, whether they do FUE or FUT. On the other hand, the strip method will leave you a permanent lesion scar for the rest of your life. And again, it's more invasive, more painful, more chance of infection. But the benefit of the strip method is cheaper. The number of grafts we can do is more, 35 to 6,000, so it's better for advanced hair loss with the strip method. The overall density is not decreased because we only take out the hair in the middle, but the density on top and below, above and below the scar is still intact. Because the strip method is more efficient to harvesting the hair graft, less damage to the root, then you have more graft can be harvested for the future with the strip method than the FUE. And then the overall density of my strip method is 10% more dense than the FUE. But again, the strip will have linear scar. I try to provide as many examples as I can. There's no technique are perfect. There's always pro and con for both, and each client choose their technique, the type of technique to undergo, and it's very personal. And so some patient is okay with the linear scar, and some patients not. So then you kind of know where to head to. Again, this is a demonstration of the FUE donor scar after 4 years. And both. I perform both FUE and FUT. Both FUE and FUT produce scar. There is no surgery without scar. And again, results vary from one individual to another. Some could be better than this, and some could be worse than this. Thank you.